China's health authorities have said the COVID wave is back with rapid decline in both severe cases and deaths in hospitals, but experts remain wary of the government's official data. According to China's Center for Disease Control (CDC), the number of critically ill patients in hospital in the first week of January then rapidly declined by more than 70%. The number of deaths also reached its highest level that week, the data said. Most international experts know this very well. China's statistics are very unreliable. COVID cases have swept across China in recent months, escalating rapidly after the government suddenly ended its zero COVID policy. A senior health official said 80% of people had been infected in this wave, although it was not clear where the figures came from. The number of deaths in hospitals reached their highest point on 4th January with 4,273 recorded before falling 79% by 23rd January to 896. The CDC said the number of visits to fever clinics peaked at 2.9 million on 23rd December before falling 96.2% to 110,000 on 23rd January. A similar decline was observed in visits to rural clinics with peaks around the same date, it said. China's CDC says the COVID peak across the country has passed since the government abandoned its zero COVID policy. It says that 80% of the population, or more than 1.1 billion people, have already been infected. Health authorities claim that visits to clinics for fever and COVID hospitalizations have declined since their peaks in late December and early January. Experts say China's population had almost no underlying natural immunity before reopening, while existing Chinese vaccines offer limited protection against infection from Omicron. So one massive wave ended up sweeping over the whole country, hitting rural and urban areas almost simultaneously.